How do families decode carrier screening terms? Imagine sitting down with a genetic report and feeling like you're reading a foreign language. That's why understanding carrier screening terms is so important. When families get tested for genetic conditions, they see words that can seem confusing at first. But once you know what these words mean, it becomes much easier to understand your results and what they mean for your family. Let's start with the word carrier. A carrier is someone who has inherited one normal gene and one altered gene for a specific condition. Carriers usually do not have symptoms because the normal gene masks the effect of the altered one. The altered gene is called a gene variant or allele. Variants are different versions of a gene, and some can cause health problems if inherited in certain ways. Next, we have autosomal recessive conditions. These are conditions that only affect a child if they inherit two copies of the altered gene, one from each parent. Carriers have only one copy and typically do not show signs of the condition. But if both parents are carriers, there is a chance their child could inherit the condition. The chance is about 25%, meaning 1 in 4 children could be affected. There are also X-linked conditions. These are caused by gene variants on the X chromosome. Females have two X chromosomes, so they can be carriers with few or no symptoms. Males have only one X chromosome, so if they inherit an altered gene, they are more likely to be affected by the condition. When families see expanded carrier screening, they are looking at a test that checks for many different genetic conditions across multiple genes. This type of screening is more comprehensive than testing for just one or two conditions. It is especially useful for families from diverse backgrounds because it covers a wide range of conditions. The test used to find gene variants is called molecular genetic screening. It looks directly at DNA, making it very sensitive and accurate. Older tests often looked at enzyme activity or other indirect signs, but DNA testing gives a clearer picture. If the test finds a gene variant, the result is called a positive carrier result. This means the person carries a gene for a specific condition. Usually, the next step is to test the partner to see if they are also a carrier. If both are carriers, there is a higher chance their child could inherit the condition. A negative carrier result means no gene variants were found for the conditions tested. This suggests a lower chance of passing on those conditions, but it does not rule out all genetic risks. Risk percentage is an important concept. If both parents are carriers of the same autosomal recessive condition, there is a 25% chance with each pregnancy that their child will inherit both altered genes and be affected by the condition. Genetic counseling is a helpful service that explains what your carrier screening results mean. Counselors can help you understand inheritance patterns and discuss options like prenatal testing, in vitro fertilization with genetic testing, or using donor sperm or eggs. In the end, decoding these terms helps families make informed choices about their health and future. Knowing what it means to be a carrier, understanding the types of conditions tested, and knowing your risks can guide you in planning your family with confidence.